Hi, I'm Dr. Francis Price, and I'm going to talk about dysfunctional lens syndrome. And you may ask, what in the world is dysfunctional lens syndrome? But it's a condition that actually affects all of us as we age. And it's a transition period between having a perfectly clear lens when we're young and getting a cataract as we get older. So you don't suddenly go from perfectly clear to, a cloudy cataract. And so this in-between time is called dysfunctional lens syndrome. But more importantly, what does that mean and how does it affect us? When we're in our 40s is typically when a lot of people notice they have to start wearing reading glasses. And that's part of dysfunctional lens syndrome. When we're babies, it's crystal clear, and probably when we're children. Gradually, as we get older, it changes color. It goes from being clear to yellow. Now, we don't really usually notice that color change. A lot of times when people have cataract surgery, they notice a big change when we take the lens out of one eye, the cataract, and put in a plastic lens, and they can compare the two eyes and see a huge difference, but they didn't notice it happening. Very often in our 40s, this starts up. And the two things we notice first is inability to see up close, gradually a little color change. And then what happens somewhere in through there is it starts to change the way we see clarity. That's the dysfunctional lens syndrome. Your lens has changed to the point that it's not bad enough to be called a cataract, but it's bad enough to be causing you a few problems with your activities. Very often we'll recommend, instead of having LASIK, even to correct your distance vision, that you consider what we call a refractive lensectomy, a clear lens extraction. There's a whole variety of names that other doctors have given these. But basically, we're taking out the dysfunctional lens. Doesn't qualify for a cataract yet, but we take it out. We put in one of these new plastic lenses that have ultraviolet filters, but you get a clearer view of the world because you don't have the yellow coloration or discoloration of your natural lens or the brown coloration. The question that we get posed a lot of times is, why should I have a clear lens extraction rather than just waiting until my cataract gets worse? And certainly if you wait, your insurance will pay for it. But it depends on what you want to have for the quality of your vision. If you want to have clear vision, you want to be able to see distance and see near and do a lot of activities that you need to have both near and distance vision, then you might as well have it done now rather than wait until your vision continues to deteriorate to the point that it's covered by insurance. When we talk about clear lens extractions or cataract surgery for that matter, we have options of what type of lens we can put in. Now, typically if someone's going to treat their dysfunctional lens and have it fixed, we'll recommend at this time the Symphony lens, an extended depth of focus lens. And why do we recommend that for this type of surgery? It gives you the best range of function from distance to near. If you want a lens that has absolutely no distortions, we can do what's called a monofocal lens. This is the type of lens we've had for years. And a monofocal lens focuses all the light in one spot, certainly gives you the clearest, sharpest vision, but it only corrects your vision in one area. We can make the focus near, intermediate, or distance, but it's really only in one spot for the vast majority of people when we use these. So the basic choices people have now are the Symphony, which also corrects astigmatism, or monofocal lenses, which are in focus in one area. And those can also fix astigmatism as well. Now, as I mentioned, many people live with declining vision and either don't notice it or just tolerate it. So what we've done here is we've actually made these changes in our video so that the quality of the video has declined for clarity and color, and this is how it actually started. Hi, I'm Dr. Francis Price, and I'm going to talk about dysfunctional lens syndrome, and that's a significant change. And this is what we can do with our modern surgeries for fixing either dysfunctional lens or cataracts.